But it's Chris over at Dixieland Farm, and I'm holding up the iPad, so it's going to be a little bouncy. It's resting on my knees, which are elevated at the moment. I'm off them. I was walking some horses out to the pasture, about 40 minutes of work, and I have to sit down. I'm in pain. So that brings me to what this video is. What is my pain level pre-surgery? So we can see, was it worth it? Right now, it's at a 4 to 5. Normally, my pain level on a scale of 1 to 10 is between a 4 and a 6. So I can function. It hurts, but I'm not dying. I mean, I've had my finger, basically kind of ripped off my finger. My fingertip, pulled off. I mean, I've had my hand split open right there. You can see the scar. Horse went one way and another one went the other way and ripped that whole thing open, and where I could see bones and tendons and stuff like that. So I've had actual pain before. So this is not that. This is, I think, a 4. It's probably where I'm at most of the time. Occasionally it'll come up to a 6. So 6 is I'm kind of on the verge of tears, but I can still function. I'm not collapsing. So 6 is probably generous, but 4, yeah. I mean, kind of a teeth bearing kind of pain. And yeah, so in my prior surgery, so this is over the last 5 years, it would hurt about the same level, and then I'd have arthroscopic surgery and then post-surgery pain. So after that's gone, it would last about 6 months, and then it would start to slowly hurt, and then by the end of the year, we were back up to a 4 to 6. And I'd have surgery and the same thing again. And then I had stem cells. No, I had surgery a third time, and same thing happened. And then I had stem cell injections twice, and those bought me a few months. And it took a few months for them to actually activate. They don't give you immediate relief. It takes a while for them to actually start rebuilding the meniscus. By the way, the meniscus does not regenerate on its own. It's one of the few things that don't. So when you get a tear and you get part of it surgically removed, it does not grow back unless you have stem cells. Or microfracturing, it's a procedure where they drill microscopic holes into the bones so the bone marrow releases stem cells. Basically kind of the same idea, just you're using your own stem cells as opposed to an external stem cell, which could have been from a donor, from you spun out blood, or something else, right? The stem cells I had, by the way, was cord blood, so it was basically placenta kind of stuff from deliveries. Anyway, that is my pain level on a daily basis, anywhere between a 4 and a 6, and I can walk for about 15 minutes before it's quite uncomfortable, and about an hour is all I can do. And of course the other knee is taking up a lot of that slack, so I walk funny. I put a lot of weight on just my left leg, and my left leg is suffering for it. So that is my pain level. If you have any questions, drop me a line, and we'll see what the pain level is way after surgery. Okay? Thanks for watching.